Welcome to the Bone and Joint Surgery Center Total Joint Education video.
We are honored you chose the Bone and Joint Surgery Center for your joint replacement surgery. Our goal is to provide you with exceptional care and the best possible experience. Your commitment to preparation for surgery and postoperative care are critical to the recovery and a successful outcome. We offer overnight stay and same-day discharge options. Your plan will be discussed with your care team at the time of scheduling.
Meet our team.
To our facility. Below you will see the contact information for the Bone and Joint Outpatient Surgery Center. The Surgery Center is located at our Rib Mountain location on Hummingbird Road. Please come to the back entrance of the building on the second level. Click below for the virtual tour of the Surgery Center.
Understanding your procedure. Click the links below the procedure you are having to learn more about your procedure.
Mako Robotics. Bone and Joint Surgery Center is the first orthopedic center in north central Wisconsin to offer Stryker's Mako robot-assisted technology for total knee and total hip joint replacement surgeries. Studies have shown patients may benefit from a faster recovery and less pain. Ask your surgeon if you are a candidate for the Mako robotic surgery. For more information, click the link below.
Dental care. Before your surgery, dental clearance is required to being scheduled for your joint replacement. Please let us know if you have any dental concerns, such as infections or cracked teeth, prior to your surgery. After surgery, you will not be able to have dental work for 6 months. For your lifetime, antibiotics will be required for any dental work.
Please stop smoking. Your surgeon may require you to stop smoking before surgery. Smoking harms oxygen circulation to your healing joint, and it is vital to the healing process. It can also be the cause of lung cancer or other lung diseases, heart disease, and increase the risk of stroke. Did you also know that smoking can decrease wound healing and bone healing after surgery and also increase the chance of blood clots?
Preparing for your surgery. Start drinking nutritional shakes or protein supplements twice daily for 2 weeks before and 2 weeks after your surgery to optimize wound healing. This could be Ensure, Boost, or Glycerna. Do not shave your legs 3 days prior to surgery. No manicures or pedicures within a week of surgery, and remove all nail polish. Use the chlorhexidine 4% soap as instructed, and use the Bupiricin ointment as directed. Schedule post-operative therapy appointments at your location of choice, and also do not donate blood within 1 month of your surgery.
If you develop a fever, cold, rash, abrasions, cuts, or other physical conditions that might concern you, please contact your surgeon. Also let us know if you've had any changes in your health history or medications since your last office visit here. For example, diabetic, cardiac medications, or blood thinners. And please notify our office if you've had any changes in your insurance coverage.
Medication instructions. Stop medications that may increase bleeding. Aspirin and prescription blood thinners should be stopped as directed by your prescribing doctor or surgeon. Anti-inflammatory medications such as Advil, Aleve, Meloxicam should be held 5 days prior to surgery. Vitamins and supplements should be held for 7 days prior to surgery. Acetaminophen or Tylenol is okay to take up until surgery.
When you come to the surgery center for your surgery, please bring your walker or crutches. If you have purchased a home cold therapy unit, this is for knee and shoulder replacement, please bring that with you as well. Bring any overnight items that you might want while you're here, like a toothbrush or toothpaste. If you use a CPAP machine, please bring that for overnight use. Also, if you use any inhalers or eye drops, we will allow you to use those while you're here, but no other home medications will be allowed. Please discuss this with your ortho nurse coordinator at the time of your pre-op call if you have any other home medications that you may need while you're here. Also, please bring some loose, comfortable clothing and well-fitted shoes to wear after surgery.
Mupirocin nasal ointment is used to treat bacteria which can live in your nose and may spread to other people. It is used in particular to treat bacteria called methicillin-resistant staph, which can cause skin infections. Although you may have MRSA in your nose and be otherwise well, it can spread to your new joint.
Applying mupirocin ointment. Wash your hands before and after you use the ointment. Use a cotton swab to apply a small amount, like a pea size, to the inside of each nostril. Press the sides of your nose together for a short while to allow the ointment to spread around the inside of your nostrils. Refrain from blowing or wiping your nose following the application. Please use twice daily starting 5 days before your surgery and the morning of your surgery.
Your skin ready. You are scheduled to have surgery that involves cutting through the skin. Because germs live on everyone's skin, there is a greater chance for getting an infection. To lessen your chance of getting an infection, you need to take special care of your skin before the surgery. Please follow these instructions. You will need to pick up an 8-ounce bottle of special soap called 4% chlorhexidine gluconate. Do not shave near the site where your doctor will be making the incision for your surgery at least 72 hours prior to your surgery. All needed clipping or shaving will be done at the surgery center. You will need to shower with the chlorhexidine soap 3 times before surgery. For example, if your surgery is on Tuesday, you would need to start the soap on Saturday and then continue it through Sunday and Monday. Do not shower on the morning of your surgery.
Cleaning your skin. Start your shower by washing your hair and body as usual with your normal shampoo and soap. Go ahead and rinse off and then take about 1/3 of the bottle of chlorhexidine and put it on a clean, wet washcloth. You can turn the water off during this time and wash from your neck down. Wash your body gently for about 5 minutes, paying special attention to your surgical body part. Go ahead and turn the shower back on at that time and rinse well. You can pat yourself dry with a clean, dry towel and avoid using any lotions, moisturizers, makeup, or any other products on the skin near your surgical body part. Please put on clean clothes.
Call the surgery center the day before your surgery to get your arrival time anytime after 8 a.m. Avoid alcohol, tobacco, or illicit drugs 24 hours prior to surgery. Do not eat after midnight the night before your surgery. This includes gum or candy. You will be allowed to drink a small amount of water or Gatorade only up until 3 hours prior to your arrival. Please make sure you wear clean pajamas and have clean sheets on the bed the night prior to your surgery. Please also be sure no pets are in your bed prior to surgery.
Scopolamine patch. You may have received a prescription for a scopolamine patch. This is used for some patients to help prevent post-op nausea and vomiting. You should apply this patch behind your ear the night before surgery. Be sure to wash your hands well after applying the patch. The patch may stay on for 3 days. The patch is not indicated for patients 65 and older, patients who have benign prostatic hypertrophy, or certain types of glaucoma. Preparing your home for return after surgery. Please clear any clutter from the hallways. Consider creating a temporary bedroom on the first floor if you have a 2-story home, if able, and remove any throw rugs or area rugs to avoid tripping on those. Secure all power and phone cords, and consider adding handrails in the bathroom and/or shower as needed. Also add some night lights in the hallways and the bedrooms to improve safety for getting up during the night.
An anesthesiologist will be reviewing your chart prior to surgery. You may receive a call from the anesthesiologist if there are any questions regarding your medical history or any problems with anesthesia in the past. You will meet the anesthesia team on arrival to the surgery center. They will discuss the options for anesthesia with you, which include spinal, general, and regional nerve blocks.
Spinal anesthesia involves a one-time injection into the back by the anesthesiologist, which will cause a temporary loss of feeling and movement from approximately the waist down. During the surgery, you will still receive sedation via your IV to keep you asleep and comfortable and unaware of what is going on. Spinal anesthesia reduces the need for narcotic pain medication and anesthesia gases during the surgery, which greatly helps reduce postoperative nausea and vomiting and other complications. General anesthesia involves breathing oxygen through a mask while the anesthesiologist gives you medication to put you to sleep in your IV. A breathing tube will then be placed. During the surgery, medications for pain and nausea will be given in your IV.
Pain control after surgery. Anticipate pain when your block or local anesthesia wears off. You will be prescribed a combination of short-acting and long-acting narcotic pain medication to help with this. Other options of pain control include anti-inflammatory medications such as naproxen or Aleve, which may be used after surgery.
Additional comfort measures include changing your position and elevating the extremity to help control the swelling, in addition to wearing compression socks as prescribed. Cold therapy unit and/or ice packs are also very effective in reducing pain and swelling postoperatively. Be sure to get up and walk around the house every hour while you're awake, even if it's for 5 minutes. This can help decrease the stiffness.
Sleep pattern disturbances are a common occurrence after surgery. Insomnia can be relieved with medical treatments and home remedies. With your doctor's permission, you may be able to take over-the-counter sleep aids such as melatonin or Benadryl. Other steps you can take include avoiding stimulants before bed such as caffeine, heavy meals, and nicotine. Doing something relaxing before bed like reading or writing in a journal or listening to music can also be helpful. Create an environment that promotes sleep by dimming lights, turn off your electronics, and keep the room dark.
Wound care after discharge. Follow your surgeon's guidelines for wound care at discharge. You may go home with a waterproof dressing called a Mepilex dressing. This would be for knee, hip, and shoulder replacements. You may be asked to change the dressing at 5 days post-op. We will be sending an extra dressing home with you. Make sure you wash your hands prior to any dressing changes. Typically, with the waterproof dressing, you may shower 24 hours after surgery or 24 hours after removal of a drain. For total ankle replacements, you will not be allowed to remove the splint or dressing until seen by your surgeon, and you will need to keep the splint clean, dry, and intact.
Potential complications that can occur after a joint replacement include blood clots, pulmonary embolism, infection, pneumonia, and constipation.
A potential complication of blood clots or DVT can occur after surgery. Symptoms of a DVT include swelling in the calf, thigh, or ankle that does not improve with elevation. You may have pain or tenderness in the calf. It can also be either leg, either the operative or non-operative. If you have any symptoms like this, please notify your physician immediately.
Symptoms of a pulmonary embolism include sudden chest pain, difficult or rapid breathing, shortness of breath, sweating, or confusion. If you experience any of these symptoms, please call 911 immediately.
Early and frequent ambulation is key in preventing blood clots. Please also wear the compression stockings or TED hose as prescribed. You may be on one of the following blood thinners, and this will be ordered by your surgeon at the time of surgery: aspirin, Xarelto, or Eliquis.
Watch for signs and symptoms of infection after your surgery and contact your surgeon if any of the following are present: swelling, redness, or warmth, drainage from the incision, increased pain, or fever and chills.
Signs and symptoms of pneumonia include cough, shortness of breath, or fever.
Ways to prevent pneumonia include deep breathing and coughing, frequent walks, and using your incentive spirometer about 10 times every hour while you are awake.
After surgery, your breathing can be shallow due to the medications, pain, and immobility. Not taking deep breaths can decrease the airflow into your lungs and can lead to pooling of secretions, which can contribute to bacteria growth, causing pneumonia.
Using your incentive spirometer can reduce the risk of pneumonia. You will be instructed on how to use this in the recovery room. Please be sure to use the incentive spirometer at least 10 times every hour while you are awake.
Constipation is a very common occurrence after surgery caused by the immobility, dehydration, and pain medication. Ways to decrease constipation postoperatively include increasing your ambulation, as well as increasing the amount of liquids that you drink. Try fruit juices or water. Please avoid caffeinated beverages. You may also add fiber to your diet by eating whole wheat bread, cereals, fruits, and vegetables. Stool softeners such as Colace or other fiber supplements are over the counter and can be purchased without a prescription. It may be a good idea to purchase these ahead of your surgery so you can begin them upon return home. Sometimes, despite these measures, you still may become constipated. A mild laxative such as milk of magnesia or X-Lax may be needed. You may also use a laxative suppository, which is over the counter, or a Fleet's enema. If you still have not had a bowel movement after trying these measures, please call your surgeon or your primary care provider.
If you need any help with your disability or family medical leave paperwork, please contact our patient document specialist at the number below.
If you have any questions preoperatively, please contact your ortho nurse coordinator. After surgery, please call and speak with the triage nurse by dialing extension 5000 with any questions or concerns. Thank you for choosing Bone & Joint.